Hi, I'm Dr. Wade Anunson. Today we're going to cover a stretch for the SI joint. It's a basic couple stretches that you can do anytime you're feeling tension in the biggest joint of your body, which is the SI joint. And it looks like this. It's actually this joint right here. Your tailbone is basically the foundation of all the weight of the body and the spine. And the largest joints you have in your body are these Sacro-Iliac joints. So not only is it bearing the most weight and pressure, it's a foundation for the rest of your spine. How you may notice sacroiliac tension and irritation is buttock discomfort, buttock tension, tension into the hamstring, low back tension that wraps around and kind of moves into the buttock. That's all SI related. Some of you might experience SI pain deep at night, where you actually feel relief by opening the legs up, and that actually takes pressure off the SI joint. So if you find yourself in that position, you're probably suffering from some SI articulation, some sacroiliac inflammation, or what they call sacroiliitis. Fancy word for that. And we're going to just give you a couple tips here to start to manage that a little better. All right, so we're going to look at our wonderful example here, Alexa, who's going to show us exactly what this stretch looks like. First one's going to be downward dog. Okay, and Alexa's going to get into a downward dog position. And some of you have seen this done. You already participate in yoga, and I know there's a lot of people that are doing it not necessarily accurate. She has created a great straightening of the spine here, and she's not just bending over and putting her hands on the floor. She's literally moving her pelvis superiorward to actually lift the tailbone towards the ceiling and a little bit back towards that wall. She's feeling hamstring tension, and she's allowing her heels to drop towards the floor and back away from the spine. While her arms are straight in her shoulder, she's creating a great straightening here, and all the force is coming through the inside of the hands, so think index finger and thumb, and the arms are straight, the elbows aren't bent. This is Alexa's position. This is something you can shoot for, but you should not try immediately. Yours is going to look not so vertical, not so beautiful at first, so be patient with yourself. You want to hit the range. How do you know when you're doing this right? You're doing this right when you start to feel tension. Show them an example of the bent leg for people that aren't as flexible as you right now. Bent leg. So this may be how you end up, where the knees are actually bent, and this is your norm. And she still can thrust the tailbone and the what are called your sits bones, your ischial tuberosities, the butt bones you sit on, back and upward. Okay? Thank you, that's perfect. So that's one. Hold that while you're breathing. Don't hold your breath. Hold that for about 60 to 90 seconds and just relax into the pose. Second one, upward dog. And you saw how Alexa got in there. Both feet, toes are back out and underneath. She's arching her low back in this fashion, and her head is up, and her arms are straight. And what she's doing also is just breathing, relaxing, opening up, and lengthening the spine, which we're doing in both cases. And she's allowing her body to hang in this position. Again, hold for at most 30 seconds. Come on up. And now we're going to show them the pigeon pose. I love the pigeon pose for those who have stiff runners, athletes who play basketball, volleyball, and they're on their legs and they're moving, they're cutting, and their glutes tend to overwork. So you get some SI and glute and butt muscle tension right in here. And so what happens is, this one is, you saw Alexa put her left leg underneath, and she's trying to seek a 90-degree angle, but in most cases, you're just starting this, it won't be 90 degrees. Do the best you can to get the foot forward, and that's it for you. Then she starts to drop down. For some of you, this could be your level right now because you're in pain, you're inflamed, you're really super tight, you have not opened this joint up. So now, this could be your normal to start as you get better and better. And while you're in this position, how you can expand is slowly breathe into the tension. For example, if there's tension in her left buttock and hamstring right now, she's breathing into that, visually speaking. Feel where that tension is. Breathe in, breathe out, relax, and don't resist. Where you feel resistance, your body, you're fighting it. In this case, for those who are in pain, this may be good enough at the start, but we want to work towards where Alexa's going next, which is She's going to start easing herself lower, which is now going to put more and more stretch into the glute and the hams. And then she can drop her head and body even further and just hang out here and let this stretch do its work while she's structurally elongating the spine and breathing. She's doing a great job of this one, and she's very flexible. She happens to be a dancer. So if there are any questions, don't hesitate to give us a call. Again, Dr. Anunson. Like us on Facebook. If you know of anybody you can share this with, please pass it on for them. Give them some relief. Help teach them a bit in terms of how to at least put a little fire out when they're dealing with some SI problems. Have an awesome day.